What's going on, everybody? Hope everybody is doing well. Sorry I've been absent the last few weeks. If you'll notice behind me, this is a new office. We moved offices this last weekend, and it's been just crazy trying to get everything up and running. And so here I am. And if you don't know who I am, my name is Ed Cara. I am the Director of Education for Smart Tools and Smart Cuffs. I developed the BFR education for them and also the instrument-assisted soft tissue. I treat patients in my clinic, Body Lounge Park Cities in Dallas, Texas. And so I use BFR pretty much on a daily basis. When I'm trying to use light loads, but get the physiological adaptation that we're looking for of strength and hypertrophy for, in my case, primarily injured tissue, but I do consult with people for performance as well. So I do this on Tuesdays, and I do it in order to answer any questions. So every Tuesday I come on, unless something crazy happens, where patients are late and I'm trying to get in and out and I only have a blocked time. So I apologize if you've been on and I haven't shown up and there hasn't been replays, but I do the best I can. We have a busy multidisciplinary clinic, and so I'm slammed, but it's all good. Can't complain when you're the business owner and things are busy. So all good. Thanks for joining me. I can see people are already, Lewis has already said hello. If you want to say hello in the chat, that would be awesome, just so I know who's here and where you're at. And if you have any questions, that's what I'll do today, is kind of go over questions. I am posting, I've created a new website called BFR University. And the reason I did this was my patients were confused. Like, there was so much BFR stuff on my personal edlacara.com website that they're like, I need treatment for my lateral epicondylitis. What I don't understand what all this BFR stuff is. So I'm kind of separating that right now. So if you go to BFR University.com. There's where I'm going to use that as a portal for most of my BFR information. You can also find information on my YouTube channel. That's just edlacara.com. I haven't decided if I'm going to make a separate one. And then you should get weekly to monthly or bi-weekly newsletters about information regarding BFR that I come across on the web, podcasts, other things. If you sign up for my newsletter on BFR University, you'll start getting that. We have our first one ready to go out for March or April 1st. So I'm planning on April 1st and April 15th, and that'll be more about the research studies that come out and other things that I don't necessarily want to talk about and take up time on these Tuesday calls. So let me see. Hello, Abe, Thomas, Chuck, Lewis. Okay, let me see, Chuck. My not so quick question. I recently attended an in-depth course for oncology rehab. Brought up the question on what their thoughts were with using BFR in the oncology, given the loss of strength and muscle mass in this general population. That mindful, thoughtful inclusion could be a net benefit, but there seems to be little or no research on this. Absolutely, I totally agree, Chuck, that anytime, hi Mike from San Antonio, my neighbor from the South, anytime that we're looking to increase strength and hypertrophy being muscle mass, but we can only use light loads, BFR it's where it's at. It's why it's so powerful. So we can use this in patients that have injured tissue, like a torn muscle or tendinopathy, ligament strain, because those people can't use heavy loads in the initial phase of rehab, but eventually they'll be able to get back up to their 100% capacity. And then you can start either using BFR as performance training, or you can start using your high intensity. If you've been following me for a while, you know my thought process that if you can do high intensity training, that should be your primary mechanism for progressive resistance exercise. We use BFR as a supplement. So I go do my CrossFit workout and I want to work on my bicep size. There's no better way than BFR in order to increase hypertrophy. It happens quick. Instead of it taking 16 weeks with normal high intensity training, it takes as little as 3 weeks to start seeing size gains in the muscle. We can use it for strength. Those are two different things, hypertrophy and strength, two different things. Strength should start to really occur within week 3, week 4, week 5, something like that. Whereas in normal strength and hypertrophy, strength typically starts to take place at about week 12. So we can accelerate strengthening and hypertrophy using BFR. Langdon, hello from Lexington. Thank you so much for joining us today. So yes, as long as there's not any contraindications to BFR, and if you look on my BFR University, there should be a blog post about contraindications, then yes, I would absolutely use BFR in an oncology clinic. Any update of shipment of devices? Yeah, I know it's been really difficult. COVID has reduced, and we're not blaming COVID in any manner. We had some trouble with batteries. Batteries were not, if you let the battery totally run out, it wasn't recharging. So there's been issues, absolutely. And so what I have heard from headquarters, I have nothing to do with the manufacturing process except for the design. I do all the programming and education. But from headquarters, I have heard that by mid-April, we should be all caught up. We're getting all these new boards in. Everything should be shipping shortly. I've been doing BFR therapy on my elbow, injected 6 weeks ago with double PRP, first time in 25 years. I hopefully will get my elbows back. So if you're having, let's say Langdon, is it a tear of like the extensor group? Is it a lateral or medial epicondylitis or a lateral or medial epicondylopathy? What is it? Because BFR absolutely will help those. I use them every day. Some patients buy their own BFR set to then you do their home exercise program with it, but some do not. And so it's just kind of where they are and how they think they're going to use it. Curious about your much anticipated advanced level 2 course. Yes, it's ready to go. What we're waiting for is, I don't want to do a level 2 online when people don't have their cuffs. So I'm waiting for us to get caught up with our back order. Once that back order is complete, I will then do probably a couple of online performance courses, get feedback, see where we're at, and then start to offer them live as COVID opens things up more and more. We are starting to see courses open up. I have a course next month. Yes, April, and I have another course lined up for May, and I have another course lined up for June. So we should start to see things open up across the country and across the world where we're getting more and more live courses done. Of course, in the meantime, we have BFR level 1 certification online. I've written courses for Medline. There's 3 courses on Medline. One is for bone growth, one is for the mechanisms, and one is for just general BFR. We're starting to see momentum come back after this pandemic has really shut us down. Is BFR indicated for shoulder replacement recovery? And the answer is yes. You just have to be careful for the first few weeks, where the incisions are, and we want to make sure that the cuff we're using lower pressures around that replacement. So you're going to use 40% limb occlusion pressure in the upper extremity, and it's going to be up as high as it can go. And but absolutely for hip replacement, knee replacement, very good. Focus was on medial, but I've had issues with the lateral as well. I double PRP'd it to cover the whole elbow. Get her done at 2. That's one way to do it. So what I would do, Langdon, if you have your cuffs, you can start doing, I like starting with just very simple exercises, like using a rubber band around my fingers and start doing opening, closing, 40 repetitions per day. It doesn't have to be unbroken. It can be done throughout the course of the day. And then you also, for the medial, you can start doing some gripping and some grip strength. And then from there, you'll start to do some things. Let me grab what I use. I love this guy. This is called a flex bar. I use this with most, if not all of my medial and lateral epicondylitis patients. It's a complicated way to do it, but if you catch on, it's awesome. My right hand is my lateral epicondylitis side. You start it, the muscles in a shortened position. So for lateral epicondylitis, this is our extensor, wrist extensor group. Start an extension, the flex bar goes in it, and my wrist is already cocked. I take the other hand, thumb down, and I torque it as much as I can. I bring it up. You'll notice, look on the flex bar and see how the striations are. See how they're all curled? And then I slowly release. This is a negative exercise. I can do this with the cuffs as well. Here, start cocked, thumb down. Slowly release. What you're doing is you're lengthening the tissue, and we're eccentrically loading that tissue. I get amazing results using the flex bar. These come in different resistances. I tend to start with the rubber bands, and then I'll go to this, and I don't really need anything more. If it's flexion, you're going to start in the flexed position. So I'll be in a flexed position. Opposite. Eccentrically load. Start in a flexed. Okay, so great exercises for those elbows. Let's see, Langdon, I've tried to connect your link on customize BFR training, but failed so far. Can you post it again? Sure. Oh, customized BFR training. Oh, working with me individually. Got it. Let me check with my VA, my virtual assistant. I will send her a note. Let me write that down. We did switch calendar systems, so that might be the problem. It's probably my issue. Customized programming. Okay. Okay, I will get to that ASAP. When using BFR, do you have to deflate the cuffs between exercise? So the answer is no, you don't have to, but if you're using the right intensity and you're using the right load, you're gonna want to. So if you're at 40% to 50% in the upper extremity and you're 60 to 80% in the lower extremity, by the time that you're done with that fourth set, you should feel like I've got to get these cuffs off. And if you don't, then the load is probably not 20 to 35% of your 1 rep max. The other thing is that if you're using a cuff that is not like our smart cuff where it is one continuous bladder, so this is our Gen 3 cuff. And you'll notice that this bladder is just one continuous. So when it inflates up, you're getting equal compression. Some of the bladders out there have little, they're segmented. And so metabolites and blood can get past the cuff, and you won't get the fatigue factor that you get with these cuffs or with the Delphi system or some of the other high quality cuffs out there. So if you're able to keep the cuff on, you're probably not causing enough stress in the tissue. And so I recommend deflating after each exercise for a minute, then reinflating. If you're doing a walking protocol, so I'm just going for a walk with the cuffs on, you're gonna keep them on for 20 minutes max, deflate for 5 minutes, then reinflate, and you can go for another 20 minutes if you'd like. Quad tendon rupture wasn't really improving. My biggest problem was that I was dangerously buckling. After 6 months of BFR, I'm back to the tennis court. Awesome. However, after therapies, I buckle. After a few days, I'm measurably stronger. What causes buckling? You know, buckling is normally because the muscles are not, there's a timing mechanism with our muscles as well. So our brain is communicating subconsciously. We don't even know what's happening. And with buckling, it normally means your muscles are misfiring. You're not getting the contraction when you need it. And so you want to start increasing quick motions. What I find when patients come to me after they've been somewhere else is that they get some strengthening and that's all fine, but they never get using quick movements like plyometrics, like using dot drills, single leg hops, double leg hops, things that will replicate being on the court or in real life. So probably a little bit of proprioceptive work would be helpful. If you look behind, you'll see I have a Bosu ball on the floor. I've got an AirX mat that I use. So you want to provide a little bit of training that involves quickness and also involves some stability training. So I would work, Abe, I would work on, see how your single leg stance is. So just go here, single leg stance, okay? And be able to do 1 minute with shoes on, stable surface. Once you are able to do that, then go shoes on, stable surface, eyes closed. So you'll close your eyes. Once you're able to do 1 minute with that, then go no shoes, which will be more unstable for your foot, on a stable surface. Then go, and when I say stable surface, you can just do, for an unstable surface, you can just use carpet. You don't, or a towel or something that creates your muscles to have to fire and work. Now with BFR, the cool thing is that you're recruiting motor units of the muscles that you typically won't get with low intensity exercise. So you should see an improvement with that as you use more and more of the BFR training. What a lot of great questions today. I am hoping that just these short sessions every Tuesday help and then get your questions answered. And I promise, Langdon, I will get a new link up for you ASAP. Let me get things to settle down a little bit, so then that way I can get caught up just with this new move in the clinic and with my normal patient care and things that I got to get done. And then I can start to take on some virtual consultations as well, because I haven't been doing that. It's just been too crazy, which I'm blessed about. All right, my time is up. I've got to get some lunch before my next patient. I appreciate everybody jumping on, and I again apologize for the last few weeks where I've been just slammed and inundated. I will see you guys next week. Of course, if you have any questions, I'm happy to answer. I am Ed at edlecara.com. Please go to my sign up for the newsletter. I will be getting that out and sharing as much content as I can daily, weekly, and monthly basis. Thanks so much. Have a great week, and I'll see you next week. Bye for now.